The ability to hear is something we take for granted. That is, until we begin to lose it. More than 50 million Americans have hearing loss. This includes 1 in 5 teenagers and 60% of our returning veterans. Hearing loss can happen when any part of the ear or auditory system is not working properly. Not all hearing loss is the same. Treatment will depend on the type of hearing loss you have. If you're losing your hearing and struggling to communicate, you may find that your quality of life is affected. We talked to the hearing aid and audiology specialists at Lake, Ear, Nose, Throat, and Facial Plastic Surgery to learn more about the types of hearing loss that can affect us and how they are treated.
There are basically 3 types of hearing loss. There's what we call nerve loss, and the fancy term for that is sensory neural hearing loss. That is basically degeneration of the hearing nerve. The most common causes of degeneration of the hearing nerve are aging, exposure to loud noise, and family history can contribute. And that is permanent. We usually see that in your mid-50s or 60s, and we can correct that by way of hearing aids. Another type of hearing loss will be what we call a conductive hearing loss. Conductive hearing loss is what we see when usually we can have some medical intervention, and we would refer them to the physician for a conductive hearing loss. And then there is a case where we have what we call a mixed hearing loss. Part of the hearing loss is due to degeneration of the hearing nerve, part of it is due to a medical condition on top of that. And so how that would be handled is we would refer them to a physician for medical treatment to bring the hearing back as much as we can, and then we would correct the remainder of the permanent hearing loss with hearing aids.
Basically, we recommend people come in every 2 years for a hearing test unless they say that there's a problem in between, because then it could be a medical problem, so they should go ahead and come in. A hearing test consists of 3 components. There's air conduction, which is through headphones or ear insert headphones, speech testing where we have them repeat words back to us, and bone conduction, which actually stimulates the hearing nerve. So all 3 of those components are required by law so that we can tell what type of hearing loss you have.
Some of the first symptoms of hearing loss would be ringing in the ears. Ringing in the ears, what we call tinnitus, is something that is a symptom of damage to the hearing nerve. So many people will come in and say, my ears are ringing, and one of the first things we will do is test the hearing, because we want to determine, is there some damage or degeneration of the hearing nerve that can be associated with that ringing.
What we're finding is that younger people now need to come in for baseline hearing tests because we live in such a noisier environment that maybe our parents did. The music, their jobs, there's just a lot more noise involved. So if you feel like you're starting to struggle, you should come in and let us test you so we can have a comparison. So if you feel like it's changed, we know what type of change there's been.
For more information on the hearing aid and audiology services available at Lake, Ear, Nose, Throat, and Facial Plastic Surgery, click on the Hearing Health Story link icon on our homepage, yourhometownhealth.com.